Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. As you know, this is a webinar where we talk about Lyme disease. I'm interested in seeing what you have in store for me tonight with your questions, because that determines what we're going to talk about. I use your questions as a platform to explain a lot of things about Lyme disease, and sometimes you get more than you bargained for with what you ask me, so get ready for it. Anyhow, for those of you that are new here, welcome. I'm glad to see some new names on my message board. And I also see a lot of familiar names as well, too. So I'm glad to see you keep getting value and you keep coming back. The way that you participate in this webinar is two different ways. One, you can listen to the questions and you can see the answers that I give for those. The other option is to write a question to me. And the way you do that is at the bottom of the right-hand side of the screen is a chat box where you can write your question. The only thing I ask about that is when you write your question, only hit the enter key one time. If you happen to hit the enter key more than once while you're writing that question, it breaks your question into multiple parts, which gets to be very complicated from my side to figure out what's going on with that question. Okay. During the webinar, for those of you that are participating, I am, or participating in the live version, that is, I will be posting the questions on the screen so you can see them. But if you're participating in a recorded version of this webinar, they don't record. So you have to rely on me reading the question, which is what I'll wind up doing. I am creating a recording of tonight's webinar so that if you happen to miss something, it'll be recorded. You'll be able to listen to it tomorrow. That's if everything goes correctly. And in the morning, I'll be posting an edited version of the video up on YouTube. And so you will be able to see that. And I send out an email announcing when that's ready. In that email tomorrow, you also have notification of when my next series of webinars is going to be and how to sign up for it. So I will be off next week in terms of the webinar. I'm still here seeing patients, but I take every fourth week off from doing the webinar. And so next week I will not be doing webinar, but I will have a series that will begin in September. And I look forward to seeing you all back then. And then finally, the last thing I'd ask is if you have benefit from these webinars, or if you think you know somebody else who would have benefit, please send them the emails that I send out. You can send them the email of the recording. You can also send them the emails announcing that these webinars are to sign up for the webinar. Okay. All right. Thank you, everyone. I appreciate if you help me with that because I'm trying to reach as many people as I possibly can with this information. Okay. All right. So without any further ado, let's go ahead and get started here. Hello, Jim. Let's see. Thanks for all you do to help the Lyme community. You're welcome. Let's see. Is it possible that taking Nystatin spray for fungus and the sinus area might affect one's candida in the gut? I'm asking because shortly after starting the Nystatin spray, I developed a rash on my stomach that has persisted for the last 10 days. This is unusual as rashes. I get almost always disappear in a day or two. If there is a connection, what might I do to get the rash to go away? So, Jim, unfortunately, diagnosing rashes requires looking at them. And as you can tell, I can't quite do that here in this webinar. I'll just give you a few thoughts. If this was an allergic reaction systemically that you were having to the Nystatin, I would expect it would not be just on the stomach, that it would be in all areas, all right? So that because the Nystatin in your nose, some of that would get absorbed, go into your blood, float through all your tissues and to your skin, and so you should not be just having something occurring on the abdomen. So the only other thing I would suggest that you probably ought to have a doctor take a look at it, because although this coincides from a time standpoint of starting your nose spray, maybe it's a completely different problem. Maybe it's a fungus infection of your skin that's separate from what's going on in your nose. I have no idea. I would need to look at it and see. But so yeah, those would be my thoughts. I'd have your physician take a look at that. Okay. All right. Good luck to you, Jim. Hello, Cara or Kara. I can't tell, but either one of those. A few questions. Is it better to treat mold yeast first with antifungals before treating Lyme with antibiotics, or should one treat Lyme first? Number two, have you used grapefruit seed extract for Bartonella? And number three, what do you make of intermittent crawling sensations on one side of the head? Okay. I'm going to answer these in reverse. Okay, so first of all, intermittent crawling sensations. Crawling sensations is a neurologic symptom. And it usually means that there's something going on with the small nerves that give you sensation in the skin. So it's a sign of neuropathy. Now that can be from inflammation of those nerves, which could be related to infection. Okay, so it's a sign of neuropathy, actually. All right. Number two, the grapefruit seed extract for Bartonella. I am aware of no studies that show grapefruit seed extract is effective against Bartonella. And I've recently been reviewing a lot of studies about herbal options to treat Bartonella, some of the newer research that's coming out of Ying Zhang's lab. And I just don't see anything suggestive that grapefruit seed extract can be helpful. In fact, people have not really looked at it for Bartonella. Okay, so I'm not aware that it would. Now, my not being aware that it would doesn't mean it won't, but I don't see any studies either showing that it might help with Bartonella. And then finally, I would also say in my practice, when I use grapefruit seed extract, I don't see that it makes any impact on Bartonella symptoms either. Okay, so for those of you that are not familiar with it, grapefruit seed extract is an herbal medicine that we can use to treat one of the two forms of the Lyme germ. So Lyme lives in you as a spirochete, that's a corkscrew-looking thing. And Lyme also lives as a microscopic cyst form of the germ. And those spirochetes can morph into cyst, and cyst can morph back into spirochetes. At least that's what we think. Okay. And grapefruit seed extract has some evidence that it can treat the cyst form of the germ. Okay. All right. All right. Then back to your mold and yeast question. So first of all, I'm going to separate them. I'm going to talk about yeast first, and then I'll talk about mold. So in my practice, I like to treat for intestinal yeast right at the beginning as I start treating somebody if they have intestinal yeast overgrowth. So by intestinal yeast, I mean, we all have yeast that live in our intestines, but if you start growing too much intestinal yeast, you're going to get a lot of symptoms of that. Key symptoms could be sugar cravings, gassiness or bloating, in women, vaginal itching, vaginal discharge, difficulty swallowing sometimes can be part of it. A lot of pimples and acne. Those are a lot of symptoms. I have an extensive questionnaire you can look at too to see do you have that really looks at this in more detail. And if you score high enough on my questionnaire, and I'll show you that here in a little bit, if you score 140 or higher, I have found benefit by treating for too many yeast at the beginning. Now, why do I treat for too many yeast right away at the beginning of treatment? Well, I do that because I know if I put somebody on herbal or prescription antibiotics and they already have too many yeast in the intestines, their yeast are going to get worse, all right? The second reason I do that is if you have too many yeast in the intestines, they add to how badly you're doing. And the way they add to how badly you're doing, when you have too many yeast in the intestines, they trigger a body-wide inflammatory reaction. Not that the yeast are living body-wide, but the inflammatory reaction is, okay? So your white blood cells, when they see too many yeast in the intestines, manufacture cytokines. And many of you know that I talk about cytokines often because these cytokines are also made in excess when you have mold toxicity. They're made in excess if you have Lyme disease and Bartonella and Babesia. Cytokines are made by white blood cells when they see these problems, and their intention is good. They're supposed to turn on the immune system. They're supposed to cause the immune system to go to where the problem is and help the immune system work better, okay? But in Lyme, mold toxicity, and yeast, often the immune system doesn't do a good job, so we wind up making too many cytokines, and too many cytokines give you most of what we call Lyme symptoms. So too many cytokines cause sleep disturbances, make it so you can't think, make you hurt all over, give you fatigue, interfere with how your hormonal systems work, etc. Okay, all that stuff that we call Lyme symptoms are really too many cytokine symptoms. And having too many yeast adds to that problem, okay? So if I determine at the beginning of treatment that somebody has too many yeast based on my yeast screening tool, I will wind up treating for yeast. Now, depending on how bad the problem is, I may not get into the antibiotics for Lyme and co-infections for a month. I might try yeast first, or if their yeast problem is more of a mild problem, I may start treating for Lyme and co-infections at the same time that I'm treating yeast, okay? All right, now, mold toxicity is a different issue. So as I just said, mold, when I talk about mold, I'm talking about mold toxicity, okay? Not system-wide mold infection. I'm talking mold toxicity. So mold toxins can accumulate in 25% of people. So 25% of us have a genetic defect that if we go into a building that has black mold and other molds behind the walls and we breathe in the toxins they're releasing, in 25% of us, those toxins get trapped in us, all right? They don't get out. And when those toxins get trapped in us, guess what they trigger? Too many cytokines, right? And so too many cytokines, if you have a condition where you have too much mold in you and you have too many mold toxins in you and you are overproducing cytokines, it can look just like Lyme disease, okay? All right. So there are situations that before I even start treating Lyme, I may work to get mold toxicity under control. So here's how I make a decision on that, all right? Because some people have everything. But if I've got somebody that comes to see me and they've got a positive Lyme test, and this happens often, people come to see me because I'm a referral doctor. Other practitioners may have seen them at one time, tried treating their Lyme, they didn't get better, and then they wind up sending them to me, okay? Or patients come to see me that worked with another practitioner, weren't getting better, and then they come see me, all right? So they come in with these tests that really do say, yeah, they've got an immune reaction showing they had Lyme. But I always like to sit down and get my own story. I like to hear what happened. What was the story? What was going on in your life when you got really sick? And for a number of patients, what I have found is they tell me, yeah, I had my tick bite years ago, but I was doing great. And then I moved into this house that had black mold on the walls. And while I was in that house, I got really sick, okay? Now, sometimes it's not as obvious as that. Sometimes I have to do a little more detection to figure out if they might have had mold. But I'm always looking to see, where were you when you got sick? And I do my own environmental assessment by taking a history to say, could it have been mold? All right. And so if it's somebody that has heavy exposure to black mold and that's when they got sick, even if they have positive Lyme testing, I'm going to work to get those mold toxins out. Okay. So let me give you a good story about that. So I've got a patient that's telling me probably maybe about 4 or 5 years ago now, that had been a coach of the local, I think, soccer team and had basically been fully functioning. I think he was a financial counselor and had been doing full functioning. And then suddenly he just got sick. And he became so sick he couldn't think. He had terrible fatigue, severe body pain. And eventually he lost his ability to care for his children. So they were taking him from him. His wife left him. I mean, it was a bad situation. His mom, who's a nurse, brought him in when he first came to see me. And he came in with Lyme testing and seen a previous doctor here in town that had thought that he might have neurologic Lyme and was encouraging him to fly out to Washington, D.C. to Dr. Jemsek out there to get IV antibiotics. And had really scared him and basically told him, you don't go out there and get IV antibiotics, your brain's going to be ruined forever and blah, blah, blah. Anyhow. So I just listened to it. I took his history, and the thing that stood out to me is he was doing well until he walked into that house that had mold growing on the walls. So the only thing we did, I got a mold toxin study on him, and it was off the charts. And so for about 4 months, that's all we did was to go after mold toxin. We did mold binders on him. And over the course of 4 months, he got his life back. And by 6 months, he was 100% well, back at work. And we never did anything to treat the Lyme infection because I think that his immune system actually was able to deal with the Lyme and may have been dealing well with the Lyme all along without any intervention from anyone until he moved into that house that had mold toxins. Okay. So it's really critical to get a good history from somebody. Okay. It's really critical to do that because sometimes it could be all mold toxins, even with a positive Lyme test. Okay. All right. So anyhow, I know I can get a little long-winded, but I wanted you to have that example. Okay. All right. So let me just do a quick screen share here. All right. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. In terms of where you can find my Lyme disease, my yeast questionnaire, take a look at my Ross Lyme support protocol, where I talk about the steps you should do in trying to get rid of your Lyme disease. And if you scroll all the way down to part 7, part 10 here, my yeast section, you're going to see that down here on the bottom, I give you a link to my yeast screening questionnaire. Okay. All right. Fill that out. If you score over 140, there's a good chance that treating yeast may help lower your inflammation cytokines. Okay. Now, if you have too many yeast and you're wondering what to do about them, take a look at my yeast section here. And here you're going to see this article that says Kills Yeast, a Brief Guide, where I talk about both herbal and prescriptive ways to get rid of too many yeast. You can also, if you want to look at more in depth about how to diagnose yeast, take a look at this this article here called "A Silent Problem Is It Yeast." I have the questionnaire in this part of the of my information site as well too. Okay, and then finally, for more information about mold toxicity, take a look at my section on detoxification here, and then take a look at this article called "Mold Toxin Illness" or "Mold and Lyme Toxin Illness." Okay, all right. Let me go back here. All right. Good luck to you. Thanks for that question. Hello, Roberta. Let's see. Do binders help with Lyme? And if so, which ones? It's a good question. So, as you know, I was just talking about mold toxins. Okay. Lyme also can release some toxins that may act the same way that mold toxins do. We don't have a good test for Lyme toxins, though. But sometimes if I've got somebody I'm treating for, say, 6 months or so, and they're not getting better, and I've gone looking for mold toxins and it's been negative, I may still try to use binders to get rid of Lyme toxins just to see if it'd make a difference, okay? No one's done studies to tell us what is the best binder for Lyme toxins. And because of that, what I would do is to try to use something I call a broad spectrum binder, something that can deal with a number of different kinds of toxins. And that would be a product by Biobotanical Research, which is called GI Detox Plus. In it is a number of binders. So it's got some zeolite clay, charcoal, fulvic acid, humic acid, and some silica. Okay. And I might work up to 2 pills 1 time a day on that. Another option, especially if that becomes a constipating issue for you, because although it usually doesn't lead to constipation, sometimes it can. Another option would be to try something called fractionated pectin powder. Pectin, which is a substance that comes from apples and some citrus. Pectin is a broad spectrum binder as well too, tends not to give you the constipation problems. And that would be 1 scoop 1 time a day on that, okay? And you try it for a couple months, see if it makes any difference for you, basically, okay? All right, let me just do a quick screen share because I know people may be wondering a little bit more about these products that I just mentioned. All right. So this is my supplement site. This is Marty Ross MD supplements. This is where my patients get supplements that I recommend. I have this site because I wanted to make sure that when I was recommending supplements to patients that I would offer them products that I trust. There's a lot of garbage out there. So I've selected those things that I find useful, and I find them also useful based on my clinical experience. So if you're looking for a place to find some things that I've tried out on my patients that I think have good success, take a look here. Anyone can purchase from here. Okay, so this isn't just for my patients. That's why I put it together initially as for my patients, but anyone can buy from here. And I'd appreciate your business basically too. Okay. All right. So in terms of these binders, the GI Detox Plus, that's this product here. And this is by Biobotanical Research, okay? And then in terms of the product I was telling you about, a pectin powder, product I have for that is this one called Modified Citrus Pectin. Now this thing has got 90 servings in it, so 90 scoops. Okay, I know the price looks a little bit expensive, but it's got 90 scoops in it too. Okay, all right. So this is what I would do for the pectin powder that I was telling you about. All right. Good luck to you, Robert. Hello, LM. I see Dr. Ross. Are you aware of Lyme causing digestion problems, especially with fruit? So, in terms of Lyme disease, if we look at two of the infections, both Lyme infection and Bartonella, which is a co-infection you can get with Lyme disease, both of those can cause some disturbance in the GI system, GI function, because they can infect the nerves that cause the gut to work correctly, okay? But if they're a direct cause of problems in the gut, usually it's going to be, they're going to lead to poor contraction of the muscles of the gut, leading to constipation. All right, so those two can give you constipation. I have not seen any relationship in research or in my own experience between Lyme and co-infections leading to specific fruit sensitivities. Okay, so fruit often has a sugar in it called fructose. And there are some people that have developed fructose sensitivities. As a means of seeing if that's you, you could try something called a low FODMAP diet, which removes fructose, oligosaccharides, monosaccharides, and I believe disaccharides. And you basically go on that diet for about a month and see what happens. Does it kind of clean things up, okay? Now, what is it that could be leading to fructose intolerance? Well, sometimes too many yeast in your small intestines can do that. And sometimes a bacteria overgrowth problem of your small intestines called SIBO, which stands for small intestine bacteria overgrowth, can sometimes lead to that as an issue as well too, okay? In terms of SIBO, the way that you test for it is you get a breath test, which can be done using a test kit. So Genova Diagnostics, for instance, has a SIBO breath test. And what you do is you actually drink some sugar water first, and then you measure, you take breath samples over the course of 2 or 3 hours, depending on what your provider orders. And you see if you breathe out high amounts of methane and hydrogen. Methane, actually, I should say methane or hydrogen or both, okay? And if you have excessive amounts, then that's called SIBO. That's how we diagnose SIBO. Now, the breath test is diagnostic about 70% of the time. There's still about 30% of people that could have SIBO and still have a normal breath test, okay? All right. In terms of yeast, I would take a look at my yeast questionnaire that I mentioned earlier. If you score of 140, think yeast. The other thing you can do for yeast, there is a urine test. Yeah, urine test. I know we're talking about stool yeast, but a urine test that you can do, which looks, it's called a microbial organic acid test, also known as a MOAT test, M-O-A-T. The company that does that is Great Plains Lab in Kansas, or Kansas City, I believe. And anyhow, one of the organic acids that they measure is something called arabinose. And if arabinose is elevated, it can be a chemical marker for having too many yeast in the intestines, okay? My preference still is to look at the questionnaire, but if the questionnaire is still clean and somebody's getting really gassy and bloated and I can't find out another reason for their gassiness and bloating, then I might come back and get this MOAT test to see what the arabinose is, okay? All right. Good luck to you. Oh, FODMAP is FODMAP, FODMAP. And you could Google that. I don't have an article on it at my website, but you could Google FODMAP diet. I'm sure you could find some resources on that. Okay? All right. Good luck to you. Hello, H. Monroe. Thank you, Dr. Ross, for weekly wisdom. You're welcome. After 20 years of Lyme-related burning and lower body, disturbing sleep, it now has fractured to the soles of my feet. Any suggestion on healing modalities? All right. So, so burning sensations like you're describing is a sign of nerve injury. Just like earlier tonight, I talked about a person was having crawling sensations in their head. That's a way that peripheral nerve injury can look. Another way that peripheral nerve injury can look and show up is having burning sensations on the skin, okay? And so, yeah, if it's moving down to the soles of your feet, then, yeah, you've got a worsened situation. So number one, I always start by looking at what could be causing it, okay? So causes can be Lyme infection, can be Bartonella mold toxicity, okay? So work with your practitioner to figure out whether your Lyme, Bartonella, or mold toxicity is a problem contributing to the neuropathy, okay? And maybe you've done this already, but I just want to make sure that you don't forget to do those basic steps, okay? The other thing, if it's worsening, that your practitioner should do, if they have not done so already, would be to take a look at thyroid function, and they might want to do a kidney liver test just to make sure that you're not getting into some liver kidney problems, because sometimes those will manifest. Some of the metabolic problems they create can manifest as neuropathy as well too, all right? And then you may also, as part of that blood evaluation, want to get a vitamin B6 level and a vitamin B12. Now, B6 is interesting because sometimes we use B6 to treat neuropathy, but you can become B6 toxic. And if you get B6 toxic, guess what you get? Neuropathy. So if you're a person that's been using a lot of B6, it could be that you got a B6 neuropathy going on. And you can actually test those vitamin B6 levels, okay? All right, now, if everything tests fine, then the next thing you can do is start to repair and support your nerves. And there are a number of things to do. There's two essential parts, okay? One of the essential parts is to work with an antioxidant called glutathione. So glutathione is a very powerful antioxidant that's manufactured in every one of our cells. And it's made in every cell, but it's also made in high concentrations in the liver. In the liver, it's used to help detox, all right? But in all of our cells, its main purpose for being there is to fix damage. And if your cells have been damaged and they've been trying to fix themselves, they may eventually burn out their glutathione gas tank, basically. They may empty it, right? So you need to fill it back up. So glutathione, the way you want to get it, you want to get a liposomal variety. And the reason you want to get liposomal means it's microscopically wrapped in fat to increase its absorption. Glutathione by itself is not that well absorbed in the gut, but in a liposomal form, it is. All right, so you would do a liposomal glutathione. The product I like for that is a product made by Research Nutritionals called Trifortify. The reason I like that product is they've got some good science showing it's absorbed. So they've done studies looking at red blood cell levels of glutathione before and after somebody took their product. And guess what? The red blood cell levels are a lot higher when people have used their product. So it does look like it's absorbed, okay? So their product is Trifortify, and you would take a teaspoon 1 or 2 times a day. Okay, that's a starting point, okay? Second thing you want to do is to fix the coverings of the cell membranes of your nerves and the membrane covering of the energy factories found in all of our cells, including the nerves, called mitochondria. So when you get neuropathy, often you have mitochondria injury as part of that, and then the cells can't generate enough energy to heal, okay? So how you fix that covering, the covering of your mitochondria is made up of a group of fats called phospholipid fats. They're very similar to the phospholipid fats that make up the nerve cell membrane as well too. So if you fix mitochondria membranes, you're fixing your nerve cell membrane too, okay? The product I like for that is another Research Nutritionals product that they have research on, again, showing good benefit. And that is a product called ATP 360. They also have a product called ATP Fuel. That you don't want to do that. That's their old product. You want to get their ATP 360 product, which works better than their old product, all right? And is easier to take too. The ATP 360 is 3 pills 1 time a day. And it's made up of a bunch of micronutrients to help your mitochondria work better, but also it's made up of those fats to repair the covering, okay? So 3 pills 1 time a day, all right? Now, those are the 2 minimum things I would do, glutathione and that ATP 360. All right. Now, if you're a vegetarian, I would also add in something called carnitine. And the form of carnitine I like to do is something called acetyl L-carnitine. And what that does, it's a transport vehicle that helps carry fat to the inside of your mitochondria, where fat and sugar are burned through a bunch of chemical reactions in the mitochondria to create cell fuel. Okay. So if you're vegetarian, you may be deficient in the carnitine, and therefore you can't get enough fat brought into the mitochondria to create energy. All right. And what you would do with that is 500 milligrams twice a day for a month, and then you can decrease it down to 1 time a day. Okay. Now, those are things I would wind up doing. All right. Now, if you're going to do this, you're going to give it a try for at least 6 months. You may get some improvements by 1 or 2 months, but the improvements will maximize at 6 months. Okay. So herbal medicines can fix things, but they don't give you rapid improvements. Okay. You're changing the structure and fixing damaged structure and function, and that takes time. Okay. All right. I'm going to show you an article that you can look at so you can see where I've written this down in a little bit more detail. All right. So first of all, before I show you that article, I just want to give you a name alert issue. Okay. So if you type in the word ATP at my supplement store, what you're going to see is 2 main products show up. Well, actually, I guess there's a few here, but ATP fuel, which is this one. I'm sorry, this is ATP fuel, and this is ATP 360. So again, get the 360. That's your better one. Okay. All right. All right. So let me come over here. All right. So take a look at in my online Lyme guide, take a look at my brain and nerves section here. All right. And in terms of how you fix the neuropathy, for more details, take a look at this article here. Okay. All right. Good luck to you. Hello, Lynn. Hi, Dr. Ross. I have trouble with tinctures, on the go too much. Is there a pill version of the Sida acuta that I can get? Good question. So first of all, Sida acuta is just hard to find. I mean, it's, and I know because I've been trying to find a supplier. So Sida, everyone, there's different forms. There's something called Sida acuta. There's another one called Sida cordifolia. And lately, or cordifolia. Maybe I should look it up. But anyhow, Sida, the family Sida, has antibiotic properties, all right? And it is useful as part of a Bartonella treatment. It may help with Lyme germ treatment as well, too, and could even be helpful with Babesia, all right? But it's hard to find. And because of that, there are not many companies that make it. So in terms of what I carry, I've tended to carry tinctures of either Sida acuta or Sida cordifolia. They're equivalent. They work the same. And even right now, my vendor just ran out of the cordifolia supply to get their raw powder from China, and they've got it on back order. So I now am out of it as well, too. So you can find online, there are companies that will make it into a pill or into the powder. I'm just not, off the top of my head, I can't tell you who they are. Okay, I don't know who they are off the top of my head, but it is possible to find Sida acuta powder. And I believe that even Buhner in his book on Bartonella describes how, what strength you would use on that as well too. Okay. All right. So you may want to take a look there. All right. But anyhow, good luck finding it. Okay. Hello, Josh. Let's see. What are your thoughts on the Amazonian frog medicine combo for treating Lyme? I haven't used it, and I don't know whether it works or not. Unfortunately, I don't have any experience using it. I can tell you I have not seen any research on it. I don't think anyone has done research on it, even laboratory research showing it works. So I don't know. I don't know if it does. Okay. All right. Good luck to you, Josh. Hello, Patsy. Hi, Dr. Ross. Thank you for hosting this webinar. You're welcome. Are we going to see Halo and Thor tonight? Oh boy. They're kind of soused out right now. I may have to break them out later, but I don't think I'm going to disturb their sleep in the middle of the webinar here. Okay. Anyhow, thank you for asking about them. So let's see here. So Halo and Thor, everyone, are my two Basenjis that come to work with me. Often, I think if you've sat in my webinars before, you usually will see Thor likes to be right back there over my shoulder in that chair back there, hopping up and down. So he usually likes to put on a good show. But tonight, he's pretty quiet under there. Okay. Anyhow, let's see. Apparently, there are potentially dangerous nitrosamine compounds in rifampin in 2020. Do you know if this issue was resolved both in Canada and the U.S.? Thank you. I believe it has been, but I would talk to your pharmacist and see what they can tell you about the supply of the medicine they're getting. But my understanding is it has been corrected. Okay? All right. Good luck to you. Oh, I'm going to try one thing here. Just a minute. I may be able to show you Halo and Thor if I have enough reach on my camera here. Nope, I can't get my camera to go down there. I was going to try to show you Halo and Thor without disturbing them, okay? But that doesn't look like I've got enough reach on my cord, unfortunately. All right. All right. Good luck to you, Patsy. Hello, Anna. Hello, Dr. Ross. What are the uses of peptides to manage immune dysregulation in Lyme? Thank you. So I have to tell you, peptides is the current shiny object in the world of Lyme. You know, shiny objects, those are the things we all flock to, right? So right now, I know that partly due to the work of the promotion, I should say, of a number of practitioners, one of those being Dr. Kent Holtorf down in California has been doing a lot of promotion of peptides. There's a number of doctors that have been trying them. I need to get a bit more training on them. And in fact, I'm going to be attending ILAD's webinar where Dr. Holtorf will be having a conference on that. But I just want to give you my general overall opinion. Although I have looked into some of them and I've seen what they may or may not do. What I would tell you is we don't have any studies in Lyme proving they do. And Dr. Holtorf is a good cheerleader for the things he believes in, and that maybe they work and maybe they don't, but he does a lot of good job talking up things he thinks will work, and some of them just don't have any science behind them, okay? So well, I have to see. The reason I called it a shiny object is everyone's trying them out right now, and we'll know within a year or two whether they're really making much of a difference. I've been at this long enough in the world of Lyme to see all these things that everyone flocks to and tries out, and then we suddenly learn most of the time they don't work, okay? So one of the big ones, for instance, was getting LDA a number of years ago. Everybody flocked and did that one, and guess what? Not many people got any benefit from it. And so I guess I would say I'm a bit skeptical to think that if we give everyone peptides of various kinds, that they may fix their immune system. Dr. Holtorf, I know, believes strongly that the way that you go after Lyme is to fix the immune system. To be honest, I think that may work for some people, but I don't think it works for the majority of people, because I don't think for the majority of people it actually is an immune dysfunction problem. So what I would say is, I think that because he's a good cheerleader and he's done a good job promoting it, there's a number of other doctors out there now that are starting to try it out. I'm skeptical. I'll just put it that way. I'm skeptical as to whether it's going to make a big difference. I've sat in one of the peptide workshops before, and I was left with the impression of a big, I don't know about this, if it's really going to make the difference that everyone's claiming. And I'm going to relook at it again and probably start trying it out on a number of patients after this workshop in October. I believe it's in October when I'll be doing that at the ILADS meeting. Okay? All right. Thanks for that question, Anna. And good luck to you. Hello, Meg. Thank you so much for the Q&A sessions. I'm learning so much. You're welcome, Meg. I have had Lyme for about 4.5 years, and I'm finally feeling better with the use of herbs. However, in the last couple months, my eyes seem to be affected, double vision, not adjusting to changes in light, etc., mostly in my left eye. Is this a common Lyme symptom? Would you suggest something other than beta-carotene or lutein, which I already have? Thank you. So first of all, I would see your eye doctor. Make sure you get your vision checked and that they do their own vision work to see if it's a non-Lyme related problem. Okay. If they should tell you that one of the issues is that some of your muscles around the eye are not working correctly to focus you, or that there is some injury to the nerves in the back of the eyeball, if it's one of those two things, that could be related to either Lyme or Bartonella. In which case, you may, if you've been treating those with antibiotic herbs, you may want to venture into doing antibiotic pills or prescriptions to see if they might work better. Okay, so I wonder about with vision problems about both Lyme and Bartonella affecting the neurologic wiring to the muscles around the eye, or to how the optic nerve in the back of the eyeball works and perceives things. Okay. But beyond that, there isn't a specific thing I can recommend to improve your vision, other than get a good eye exam and consider Lyme and or Bartonella, especially if your eye doctor sees some issues that suggest optic nerve injury, which is your vision nerve, or nerve injury supplying how the muscles, work around the eye. Okay? All right. Good luck to you, Meg. Hello, Patty. Let's see. Hello, Dr. Ross. Thank you for your commitment to these webinars. You're welcome. Let's see. I have a major issue with sleep that I feel is keeping me from progressing with my healing. I read on your website a recommendation for a product called Zen with L-theanine and GABA. They also offer a product called Zen Sleep, which has 5-HTP as well. My problem is waking in the middle of the night. I'm not able to get back to sleep. Do you have one of these products as possibly helping? I currently take a product that has L-theanine, melatonin, 5-HTP, valerian, and lemon balm. It gets me to about 4 a.m. What would be a safe level of GABA to try with this current product? Okay. So in terms of so that one product you have has a lot of different things in it that we use to affect sleep. So theanine is an amino acid-like substance that in the brain is turned into GABA. All right. Our brain has a group of receptors which are called benzodiazepine GABA receptors. And if you give more GABA binding chemicals to those GABA receptors, then that can induce sleep. So GABA induces sleep, and L-theanine, as it is converted into GABA, can produce sleep too. Melatonin is something that can induce sleep. It's usually better at getting you asleep than keeping you asleep. 5-HTP may be something that if you get higher levels of it that could keep you asleep, although it can help get you, but it also has a better chance of keeping you out. And I'll say more about that in a minute. Valerian is a benzodiazepine, a Valium-like herb that binds to the benzodiazepine receptors, we think, okay? And so it has Valium-like activity, but it's a short-lived Valium-type activity. And lemon balm tends to be short too, all right? Of all the herbs that we can use for sleep, the one that I have found that has the better ability to keep you out after getting you out is 5-HTP. And so you can use before bed a total dose of 5-HTP. A good total dose of 5-HTP would be anywhere from 200 to 400 milligrams. So most of these supplements that you've been looking at will not have 400 milligrams of 5-HTP in them. Okay, they'll probably have 50, maybe 100 milligrams, and that's it. So what I would do, look at what you have in your current supplement looks like a good product to get you out. Okay, but I would just get a 5-HTP product alone, 5-HTP alone, and take enough of it so that your net dose of 5-HTP between your current supplement and what you add to it with 5-HTP does not go over 400 milligrams. So anywhere from 200 to 400 milligrams can be a good sleep dose. So you might try 200 milligrams first night. Next night, if that doesn't work, up to 300 milligrams. And the next night, if that doesn't work, then try the 400 milligrams. Okay? All right. So good luck with that. The 5-HTP product I use, I believe, is a Thorn product. Let's take a look at that and see. All right, so for 5-HTP, yeah, so it's a Thorn product, okay. And this product is 2 capsules is 100 milligrams. So this is a 50 milligram product, okay. All right. All right, Patty, good luck to you. Hello, Christopher. Hi, Dr. Ross. Recently, it feels like I am walking on bubble wrap with mildly swollen feet. What is likely causing this? How would you treat it? Is it caused by Bartonella? So, Chris, I would need to ask you a lot more questions. It could be a Bartonella symptom, and I would need to know more what we've tried before, you've tried before. If you're the Chris I'm thinking of, I would need to review what I've tried before with you and then try to figure out a different game plan, okay? But just quickly off the top of my head, I can't say, okay? All right. Good luck to you, Chris. Hello, Joyce. Hi, Dr. Ross. Hold on here a minute. Okay. All right. See, I'm currently taking Sida, which is the Elk Mountain product, a 1-to-5 tincture, along with Hutania, the herbalist and alchemist tincture for Bart, and Otoba, along with Unicarine Max. It's a 1-to-3 mixture of Unicaria tomentosa, I think I got that. Okay. You're chronic at 20 years. I switched to these over the past few weeks when you ran out of the wildcraft herbs, exception is Sida. Do I dose these at the same rate of 30 drops each 2 times per day? I don't remember the herb ratio for the wildcraft. When I first switched to Rainforest Pharmacy, I started with only 10 drops 2 times a day, as I was instructed these are very potent. I started feeling sick again, so I have been increasing, and I'm up to 14 drops 2 times a day. Is there a suggested site for guidance on dosing herbal extracts? Okay, so this all gets very complicated in terms of how do you compare one herbal extract to another, okay? So the wildcraft tinctures were all 1-to-3, meaning 1 part plant to 3 parts alcohol. But the tinctures were created up in Canada, where it's a lot cooler environment, and therefore in that environment, you could have had less of a chemical extract, even though there was more plant. That does not necessarily mean you had more chemicals, because in cooler environments, you may not get as much of an extraction of chemicals into the liquid, okay? So the big point here is you cannot directly compare ratios of plant to liquid to determine potency, because potency of the end product depends on how much of the chemicals actually get into the liquid or extracted into the liquid. One factor is how much plant is in there. Another factor is temperature. Another factor is the quality of alcohol used. It could also be that just because you have a 1-to-3 tincture, there is only so much of the active chemicals from that plant that can get absorbed into the liquid. And even at higher and higher levels of plant, you may start getting less and less ability for more chemicals to work their way into the liquid. So a 1 to 3 may not really be that much stronger than a 1 to 5. All right. So anyhow, there's a lot of factors that go into it. Generally, what I've been advising my patients to do is we move from the wild crop products that were all a 1 to 3 mix into these other products is to do a 1-to-1 dosing change. So if you were doing 30 drops twice a day on Hutania, stay at 30 drops twice a day. If you do get knocked down, you may want to decrease to half of that and then slowly build back up, okay? The part of the problem with all of these tinctures is that they're not uniform in terms of the milligrams of active chemicals that are in them. There's no place they list out what are the chemicals of unicaria that actually make it into the end liquid. We don't have milligrams, all right? So it's all an approximation, basically. So there isn't a website I can even send you to, all right? Because there's many things that affect potency, including how much plant, what's the temperature the extraction was done at, type of alcohol used, etc. And so there's a lot of factors. So a 1 to 3 tincture may not be stronger than a 1 to 5 because the end product may still have the same constituents in it. Okay? All right. Good luck, Joyce. I know it's all confusing. I wish it was a little bit more straightforward than that. Hello, Andrea. Let's see. Hi, Dr. Ross. I've been treating Lyme, Bartonella, and Babesia for a little over a year now. I'm still having symptoms, but my last test results through Armin Labs is showing negative on the Ellis spot for all infections. My CD57 is also very low at 26. What does this mean? Are my infections really gone, or is my immune system just so bad that I'm not producing any killer cells to show up on the test? I'm very confused. I still feel terrible. Okay, so first of all, so when it comes to what Armin Labs is doing is they're measuring the amount of T white blood cell activity you have against germs. Okay, and so that is your immune system activating against the germ. All right, and some practitioners wrongly believe, in my opinion, that if you don't have T cell activity, it means the germ is gone. Okay. Now, that could be so. For some people, that may be true, but not for everyone. Part of the problem is when you have active germ infections, the germs can also suppress the immune system, making it so that the germs may be still in there partying on and be having lots of germs out there. And they could suppress the immune system so much that you don't have a T cell reaction. You have a negative Ellis spot, not because the germ is gone, but because they're doing a great job suppressing the immune system. Okay. Now, having said that, there is an occasional person that if we've treated them for years and years and we're not getting anywhere with the treatment, I may start looking at other causes that could be elevated their cytokines and go after those, even though I know that the Ellis spot is not always predictive. But if you've only been treated for a year and you still have a lot of symptoms, even with a negative Ellis spot, I would, in my practice, I would still consider treating you longer for active infection because the Ellis spot, there's no studies that have been ever done that prove that a negative Ellis spot means negative germs. All right. And mainly for the reason I just said, one of the big reasons that you can still have a negative Ellis spot and still have less germs is immune suppression, okay? Which means you've got raging germs going on in you. The other thing that could be happening that can lead to negative Ellis spot is that the Lyme germs can hide. They can sequester themselves away in tissues where the immune system can't see them. So they can live in your joints or they can live in your tendons and ligaments, all right? So they can still be in you, but because they're not circulating in the blood directly, the immune system may not see it. So you get a negative reaction for that purpose too. All right. So in people that have been treated for shorter lengths of time and of a year or 2 years, let's say, and they're not getting better and suddenly they get a negative Ellis spot, I strongly disagree with all my colleagues who somehow think that that is proof the germ is gone. There's been no one that's ever done a study proving that. And as I said, you could have negative ellis spot because of immune suppression or the germ's hiding. Okay. So I would consider still treating. All right. If I were working with you, that's probably what I would wind up doing. All right. That is if you have a lot of symptoms still, and it sounds like you do. Okay. All right. Good luck to you. Hello, Kate. Hi, Dr. Ross. I was just wondering when you take on whether or not to stop, wondering your take on whether or not to stop low-dose naltrexone before, during, or after getting the vaccine. Actually, let me read the rest of your question here. Additionally, do you ever find that patients with site candida overgrowth, or even patients who had it but longer, do develop candida sensitivity? And what do you do in these cases? With that, I think I may have a slight candida overgrowth and leaky gut, but don't want to take any more real harsh killing agents. Can probiotics alone fix this? Okay, so LDN, everyone, is low-dose naltrexone. Naltrexone is a narcotic blocker and endorphin blocker. We have endorphin receptors in our system. Endorphins regulate our pain, but they also regulate our immune system. If we provide a temporary blockade of those endorphin receptors by using low doses of naltrexone, that can help create rebalance an overactive immune system that is attacking us, okay? It adds balance to the immune system. In and of itself, it does not directly affect cytokine levels, and therefore in and of itself, it does not potentially alter the outcome of the vaccine. So I would keep taking it. That's what I'm recommending my patients doing. I don't see any interference with how the COVID vaccine works, okay? All right. Now, why am I raising cytokines with a COVID vaccine? Well, when you get the COVID vaccine, the immune system's first response will be to make cytokines. And those cytokines are a signal to other parts of the immune system to come in and start attacking the germ, okay? And I've argued before, we may not want to limit that, but for people that have a lot of Lyme symptoms, I've actually started shying away from that, and I actually do have them keep on their anti-cytokine things these days, okay? So I've changed my opinion on that a little bit, okay? All right, in terms of if you've got yeast and you don't want to use anything to kill them, there's two things you could do. One is get on a really lean, low sugar diet, okay? Get on an anti-candida diet, okay? Starve those yeast, all right? So anti-candida diets will be diets that will have basically removes most possibility of having simple sugars that feed the yeast, okay? So take a look at an anti-candida diet. And yes, you could have large amounts of probiotics, and by starving them and putting new probiotics in, you could potentially take care of your yeast. You could, it's possible. The other thing you could do instead of using prescription anti-yeast medications is to what I just said. You could do some herbal anti-yeast medications. A simple one would be to do a crushed clove of raw garlic a day. Crush it, either put it across salad or drink it by putting it in water, drink it down. Garlic is great at killing yeast as well too, okay? Or you could do an anti-candida a yeast herbal mix, which would be have things like caprylic acid in it, garlic and oregano, and that product is something called Capri Plus, and that's 2 pills 2 times a day. All right. So everyone, that is Mr. Thor. This is who I was trying to tell you about earlier. It looks like he's come out. And since he's come out, I'll say hi to him here. Okay. So when I talk about Halo and Thor, this is one of them. This is Thor. He's one of my Basenjis, and he's who you see hopping around back there from time to time. Okay? All right. Anyhow, there we go. Okay, Mr. Thor. I told Thor I was going to make a TV star out of him someday, so there you go. That was his moment. He's had other moments here, too, as many of you know. Anyhow, okay, so back to your question then. In terms of, I'm not clear what you mean when you say candida sensitivity. Okay, so Candida can give you symptoms. It can give you, if you've got too many candida living in you, the symptoms that you can have could be gassiness and bloating, sugar cravings, pimples and acne, and feeling badly because they trigger too many cytokines. That isn't what I would call sensitivity. That is just a candida reaction, all of those symptoms, okay? By sensitivity, you may also mean that your immune system is making antibodies against candida. And yeah, that can happen from having had yeast living in you. Over time, that sensitivity does go down, though, okay? All right. Anyhow, I hope that gives you some input there, and good luck to you. Hello, Julia. Say hi, Dr. Ross. I recently had mold removed in my home. It wasn't too badly infested. I did everything the mold inspector who was recommended by my SIRS doctor requested. After removal, I retested and my HERTS-me score was a 0, the best you can get. Before it was 12. I also got rid of all my porous items. I could clean and wipe down everything with EC3. Do you see patients being able to tolerate their environment after the steps I've taken? Do you think the HERTS-me 2 is a good test? I don't feel any different in my home than other places, but my doctor said my reaction could be delayed. I have tested positive for Lyme and Bartonella. It's hard to know what is Lyme and what is mold symptom-wise. My main symptoms are floaters, burning nerve pain, and anxiety. Thank you. All right. So I do think the HERTS-me is an accurate test. It's a scoring system to see if you have a mold in the home that could produce mold toxins, all right? But let's talk about what happens in a home when you have mold. There's 2 types of reactions you can have. Number 1, some people have mold allergies, all right? So when they're in a house that has mold, they react to the mold spores and the living mold by having allergic symptoms that are due to too many histamines being made by a group of cells in your body called mast cells, okay? All right, so you can have mold allergies. Right? The other problem you can have when you live in a house that has too much mold is you could be one of the 25% that I discussed earlier with you tonight that build up the mold toxins. And getting those mold toxins out requires that you use binders. The way to find out if you have mold toxins in you is to do a urine test to see, do you have mold toxins in you, okay? And if you do have mold toxins in you on that urine test, it could take a good 3 months to 6 months to get them out. And because it takes forever to get mold toxins out, just having a clean environment does not mean you got rid of all the mold toxins in you, all right? So if your primary problem of having mold in your home was that you developed mold toxins in you, just having your house cleaned up will not cause you to feel better, okay? If your problem was that you also had allergic reactions to those mold, getting your house cleaned up could cause you to feel better, okay? The majority of people, though, don't have a mold allergy problem. They've got a mold toxins trapped in them. Okay. Now, if your physician is primarily a doctor that has trained with Richie Shoemaker to do about treating mold toxicity, she probably has not done urine testing to see if they have too much mold in you. In the world of mold toxins, there's 2 camps. Okay. There were a lot of people trained by Shoemaker, and then there's another group of us that broke away from Shoemaker and think that he's missing something, okay? So we kind of advanced the science, all right? So the problem with Shoemaker's way of looking at mold toxins is he does blood testing, and doctors that work with his method do blood testing to see if you have inflammatory markers suggesting you have too much mold in you, okay? So these would be things like VEGF, TGF-beta-1, MSH, VIP levels, all that stuff, C3A, C4A, all of those tests that he does, all right? The problem is a lot of those abnormalities in those tests that are Shoemaker labs could also be triggered by having Lyme in you. So when you have Lyme, those tests are not necessarily realistic indicators as to whether you truly have mold toxins in you, okay? And so therefore, most of us that treat Lyme will actually rely more on urine testing and not the Shoemaker labs, okay? So if your doctor has not done it, you may want to talk with them to see if they would do urine testing. If he's a true Shoemakerite, he will tell you he just doesn't believe in them, and he'll give you all kinds of reasons he doesn't believe in them. But Dr. Shoemaker doesn't believe in chronic Lyme, and he doesn't understand all of the problems that chronic Lyme creates that will mimic mold toxicity. And he thinks that his lab abnormalities are always only due primarily to mold in a chronic situation. He misses the point that it can be Lyme doing that. Okay? All right. So, sorry, there's politics even in the world of mold toxicity. Okay? All right. Good luck to you, Julia. Hello, Dipti. Let's see. Hello, doctor. I want to ask, how long does shortness of breath take to come under control in an acute bite? My 6-year-old son was bitten 2 months back, and we have been on antibiotics since beginning. He is on Bactrim, azithromycin. Also, naturopath has given him Sida and Hutania. What can I expect improvement in shortness of breath? His lungs are affected. Is it permanent damage to the lungs? Okay, so Dipti, to give you the best response, I would need to actually ask you a lot of questions, but I'm just going to give you some general comments that you can take back and discuss with your naturopath, okay? Okay, so there are 2 infections in the world of tick-borne infections that are thought to give air hunger, feeling like he can't get enough air. One of those is an infection called Babesia, which is a blood parasite that lives inside your red blood cells. And then also Bartonella can do it too. And the way that Bartonella can give you that feeling like you can't get enough air is it can infect the cells that line the covering of or the inside of your blood vessels. And as they swell up, they swell into the opening and they limit blood flow to your lungs, basically. So you're not getting enough oxygen carried out of the lungs, all right? So to see if he might have Babesia symptoms that your Lyme doc may have considered with you already, but I'll just tell you what they are. Symptoms that can suggest Babesia, one of those is air hunger, like you're describing. But also other symptoms can be night sweats. Sometimes people with Babesia will have a lot of headaches in the front of the head. They can have skipping and racing of the heart, okay? So if your son has some of those, then your doctor may want to reconsider about having them on a treatment for Babesia. Of the things you're currently taking, the azithromycin could help with Babesia, but it won't get rid of it by itself. Siddha might help, but it won't get rid of it either. And they're not the strongest ways of going after Babesia, okay? So you have your treatment really is not, his treatment is not really targeting Babesia. In terms of the Sida, acuta, Hutania, and azithromycin and Bactrim, those are all great for Bartonella. And usually if you're on a Bartonella treatment that's working by 2 months, you should start having marked improvement in symptoms. So again, if he's not getting better, he still has a lot of shortness of breath, you got to wonder, are they missing one of the co-infections? And they're easy to miss, okay? And we don't have the best testing for these, and we have to go on our clinical suspicion, okay? One other thing, we have to remember that people with Lyme and tick-borne illnesses also develop other problems, all right? So shortness of breath can be asthma, all right? So if he's not getting better with treatment, then I hope they have considered and are thought about looking at him to see if he could have asthma as part of this as well too. Okay, all right. So I'm going to just give you a brief article. I'm going to point out a couple resources here for you to think about and possibly share with your treating physician for him as well too. All right, so in terms of Babesia, how to diagnose it, take a look at my How to Diagnose section here. And in this article called How to Diagnose Babesia, I list out the various symptoms that somebody with Babesia might have. Okay, so take a look at that. All right. All right. And then in terms of what's the best treatments for Babesia, take a look at my infection treatment plan section here. and take a look at my guide called Kills Babesia, a brief guide where I review some treatments that you can use for babesia too. Okay. All right. Good luck to your son. Good luck to you. Hello, Margus. Yeah, how exactly do mold toxins get through walls? Well, they're a gas, and so all of our walls are not necessarily gas impermeable. Even drywall is not gas impermeable. So they're a gas. They're small particles that can work their way through drywall, basically. They also can work their way through the seams and all that as well, too. Okay. All right. Good luck, Margaret. Thanks for the question. Hello, Lynette. Let's see. Last week, there was a notation in the summary from the webinar about not taking general anesthesia. I need surgery on one finger for a fusion from rheumatoid arthritis. And the doctor says local and twilight. Would that work? Yes, probably. I think you'll have to clarify what he means by twilight. But all right, so the two ways that we can sedate people for surgeries, one is called general anesthesia, and another one goes by a term that also goes by a term called conscious sedation. I love that one. It's conscious sedation. So the general anesthesia means they're going to put a breathing tube down you, and you're going to breathe anesthetic gas. So it has to be done with an anesthesiologist. That's the kind of anesthesia that can sometimes activate Lyme. Okay, not all the time, but some of the times can. All right, versus conscious sedation, what he may be calling twilight, means that they're going to give you medicines through your veins like Valium and Valium-like medicines to just make you super sleepy and put you out. Okay, that kind of anesthesia is okay to have. Okay, and by the word twilight, I think that's what he means. Okay, all right. And local means they would do some injection of numbing medicine around the joint before they do the fusing. That's okay to do too. Okay, all right. Good luck to you, Lynette. Hello, Kara or Kara. I wish I knew which one that was, but does oil of oregano work for yeast and Bart as well? So yeah, oregano, as you know, I talk about oregano as being one of the substances that the lab at Johns Hopkins University has shown can treat growing Bartonella, growing Lyme, and can treat persister Bartonella and persister Lyme. Right? Oregano also has the ability to kill yeast. So yeah, could work on all of those. Okay. All right. Good luck to you. Hello, hi Dave. Hello, I recently saw a YouTube webinar with Dr. Horowitz and Dr. Cameron regarding the vaccine in us Lyme patients. Dr. Horowitz highly recommends taking 2,000 milligrams of glutathione a half hour after getting the vaccine shot and 6 hours after that, while repeating the same dosage the following day to block inflammation. He states this will help pull out of the PEG in the vaccine. Also, he recommends starting curcumin, glutathione, vitamin C, and zinc supplements a few weeks prior to the shot to shut down the inflammatory pathways. I know you recommend the opposite in regards to stopping anti-cytokine supplements 1 week prior to vaccine and resume 2 weeks later. Any thoughts on his points of view? So this is the $1 million question. So again, let me just talk about mechanisms, and then you can understand why Dr. Horowitz recommends what he does and why I recommend what I do, okay? So again, the way that your body gets triggered, or the way that, so when you get the vaccine, the immune system, some immune cells will see these foreign proteins starting to be produced called the spike protein, okay? And the initial reaction that your immune system will use is they're going to make inflammatory cytokines. And yes, it is true. Inflammatory cytokines can make you feel bad. They can give you fatigue, make you hurt, make your brain not work right, et cetera. They can do all those things. They still have an important function, though, and that is that they're going to tell other parts of the immune system to start making antibodies and to learn how to attack this germ. Okay, so you need some degree of a cytokine signal to to create the effectiveness of the vaccine. Okay, so what would be and what I don't know. I mean, Dr. Horowitz is more concerned about preventing the symptoms of the vaccine. I'm erring more on the side of saying, gosh, for most people, we want to make sure it's going to work, the vaccine. Okay. The trouble is there's been no studies done. I don't know if the type of treatments that Dr. Horowitz recommends would actually decrease the effectiveness of the vaccine. I just have no idea. No one's done it. I am concerned in theory that it might. Okay. Having said that, there are certain patients of mine that I know just have extreme cytokine reactions to everything that I am starting to recommend they continue taking their anti-cytokine herbs, including the glutathione. Okay. So I don't know if Dr. Horowitz is right or wrong. I don't know if I'm right or wrong because both of us are working from a theory. Okay. My theoretical concern is that you need cytokines. You need them to tell the immune system to get active against COVID, which then creates the ability to develop immunity. Horowitz, on the other hand, is concerned that in some people with Lyme, that increased amount of cytokines maybe make you too sick. Okay? My experience is that basically, if we do nothing, we know from research that was done by MyLyme data that people with Lyme are having the same reactiveness to the COVID vaccine that people without Lyme do. Okay, we have no worse of a chance, those of us that have Lyme, if you are one of those people that have Lyme, than anyone that doesn't have Lyme. All right, that's what MyLyme data tells us. Okay, so anyhow, it's just a difference of opinion, and I don't know if he's right. Yeah, I don't know if I'm right because no one's done that research. Okay, all right, but thanks for asking that question. Hello, Alex. Let's see. Hello, Dr. Ross. I have a hard time staying asleep. Normally, I wake up 2 times in the middle of the night to urinate. My doctor recommends me taking 60 milligrams melatonin a night, but I have taken 15 milligrams only to feel horrible the following day. I see that you stated in your site, do not exceed 9 milligrams a night. Do not take during the day due to cancer risk. Is 60 milligrams way too much, and does melatonin cause cancer? It can. I mean, in theory, melatonin can, and that does go up with the amount of dose that you take. I don't see benefit in doing the kind of doses he's recommending. I can't say he's necessarily wrong, but it's not what I would recommend. Okay, so I stand by what I recommend on my site. Okay, all right. Good luck to you, Alex. Hello, John. Let's see. Besides the questionnaire on your website, is there a yeast test, blood perhaps, to confirm if you have too much yeast? Also, what medications are the best to get rid of it? And how long does treatment normally take to remove the yeast? Thank you, John. All right. So in terms of blood testing, there are a number of doctors that will do blood testing, and I think it's invalid. That blood testing would be to look and see if you have antibodies against yeast, okay? Meaning, has your immune system reacted against yeast? So they'll measure yeast IgG, maybe IgM, maybe IgA antibodies, all right? The trouble is we all have yeast living in our intestines. So you can expect that even if you don't have too many yeast living in your intestines, that your immune system might make antibodies against it. So just measuring antibodies against yeast does not prove you have a yeast problem, okay? Because it could be there, meaning the immune system has kept them under control. What we're really interested in is, do you have too many yeast living in your intestines, all right? So that questionnaire is fairly reliable. The other thing you could do that I mentioned earlier tonight is there is an organic acid test, which is a urine test that measures how much organic acids do you pee out. And one of the organic acids that you can pee out if you have too many yeast living in your intestines is something called arabinose. And that can be helpful, but it's not perfect. In other words, I have found that people have normal arabinosis that have extreme symptoms of yeast seen in my yeast questionnaire. And if I treat yeast, they feel better, even when their arabinosis is negative, okay? But if you're looking for some type of a test you can do, it'd be a urine test. But there's not a reliable blood test to see if you have too many yeast in your intestines, okay? All right. And then in terms of what treatments to do, I'll tell you what, I'm not going to review them with you right now, but I'm going to show you where to do it. The reason I'm not going to review it is we're getting near the end of the webinar. So I'm going to just do a quick screen share here. All right, take a look in my yeast section here. Take a look at my guide called Kills Yeast. It's a brief guide. Generally, with the prescription options I outline here, you need at least 30 days. With the herbal options I outline here, you're going to need at least 60 days, okay? All right. Good luck to you, John. Hello, Andrea. Let's see. Hi, Dr. Ross. I've been treating Lyme, Bartonella, and Babesia for a little over a year now. I'm still having symptoms. My last test results through Armin Lab. Oh, I think we talked about that earlier. All right, we did. I did address that earlier. Don't trust Armin Labs in this situation. That's what I would say, okay? Hello, Kate. Let's see. My mycoplasma numbers are through the roof, but my Lyme is in remission. Do I do anything about this? I don't think I have symptoms of it, but I'm not entirely sure. I think my symptoms can be explained by too many yeast and leaky gut things. Okay. So mycoplasma, I know there's a number of my colleagues, including Horowitz, that like to chase after mycoplasma. And I think they misunderstand something. So let's talk about that, okay? So the problem with mycoplasma is it's a very common infection found in healthy people, all right? Meaning you can have mycoplasma in you and it causes you no health problems. In fact, if we were to pull 100 healthy people off the street, these are people that have no health problems. They tell you, I have no health problems. I feel 100% well, okay? If we were to pull 100 of those people off the street, we'd find evidence in them about maybe 10 or 20% of having either elevated antibodies, marked elevated antibodies against a number of virus infections, including human herpes virus type 6, human herpes virus type 8. Those are non-sexually transmitted herpes. They're respiratory herpes, okay? Cytomegalovirus, Epstein-Barr virus, parvovirus B19, and 2 bacteria, Mycoplasma pneumoniae and Chlamydia pneumoniae, okay? All right. These are healthy people that have marked elevated antibodies, all right? So just finding marked elevations of antibodies does not mean your immune system lost control. It can mean the immune system is doing what it's supposed to do, which is keeping these germs under control, all right? We can cohabitate with them. They live inside of our cells, and we have the ability to cohabitate with them, just like we have the ability to cohabitate with germs on our skin, okay? So I don't treat mycoplasma. I think it's a background noise. Having said that, most of the treatments that we would do for Bartonella and a number of the treatments that we do for Lyme also take care of mycoplasma, all right? So if I'm wrong, just by treating Bartonella and using intracellular treatments like azithromycin, chlorpromazine, doxycycline, minocycline, tetracycline, rifampin, rifabutin, Bactrim, all of those can potentially get at mycoplasma. All right, so probably, even if I'm wrong, and mycoplasma is this huge problem that Dr. Horowitz thinks it is, guess what? The treatments we do for Lyme and Bartonella probably take care of it too, okay? So anyhow, if you feel pretty good, it's probably not mycoplasma, okay? All right, good luck to you, Kate. Hi, Sherry. Let's see. Is herxing typically experienced throughout the course of antibiotic treatment? No. So herxing is an increased level of cytokines that get produced related to the introduction of a new antibiotic or increasing the dose of the antibiotic. It's increased killing that triggers more cytokines to be made, okay? But during the course of your illness, you may get up and down. Every time you get worse does not mean it hurts. It just means as a course of the illness, the immune system periodically will get more reactive to the germ and make more cytokines. Technically, a herx is more cytokines produced because of more killing of the germ, okay? All right. Good luck to you, Sherry. Hello, Monroe. See, have you found IV color light therapy a successful protocol for Lyme? No. I'm not even sure how it would work effectively at killing anything, to be honest with you, okay? And I would say there's no studies that show IV light therapy works, okay? So I'm not sure why your doctor would think it works. There's nothing in the literature to suggest it would, all right? All right, everyone, that's it. Actually, Kara writes one last question. Do you recommend molybdenum supplements to those who cannot tolerate garlic? I see no problem in doing that. I'll put it that way. It's not that I recommend it, but I see no problem in doing that. Okay? All right. And with that, I actually got through all the questions tonight. That's a big deal. It doesn't happen all the time. And we're right at the end of the webinar, so it worked out perfectly. All right, everyone. So I've had a good time with you here tonight. I hope you got some meaningful and useful information. Again, I would hope you would join me in spreading the word about what we're doing here in the information so that others can get help too. Tomorrow morning when I send out the email announcing that the webinar recording is ready, I'd appreciate if you'd share that with other people as well too. Okay? All right. And so look for that email to come out somewhere tomorrow morning, probably between 9 and 9:30 in the morning at the latest. I often get it done sooner. It will include a synopsis of what we talked about tonight. In addition, it will include the sign up for the next series of webinars beginning in September. Okay? All right. Good night, everyone.